Their object was they wanted to implement a National Health Care Act, a Socialized Medicine Act. They would have implemented Hillary Care exactly if they thought they could have gotten it done. They went as far as they could get, and it took legislative shenanigans to get it done.
In an effort to keep the health care fight in the forefront of the national debate, Congressional Republicans and the Restore America's Voice Foundation held a press conference Wednesday where they presented the petitions of 1.6 million Americans demanding the repeal of Obamacare.
I think you take a look at any poll, I don't care what state, what region, throughout the country, people do understand that this health care law is going to do great harm to a health care system. And I think they're beginning to realize that it's not going to decrease premiums like the President promised, $2,500 per family. It's increasing premiums, and it's also going to blow a hole in our federal budget.
Companies aren't growing beyond 50. They're setting up business plans that stop at 49. And when you see the costs of your insurance premiums go up, that means it's harder to keep the employees under the number of 52.
It's not just a political issue. It's an economic issue. It's a countrywide constitutional issue. It's an issue of freedom. And it takes away freedom to be that subjected to the federal government. And that's what this is all about.
Lawmakers were also quick to describe the sorts of conservative reforms to health care that they would like to see.
In the immediate aftermath of the repeal of Obamacare, I'm going to celebrate. And then I'll wake up in the morning and I'll start talking to you about things like repealing McCarran and Ferguson so we can sell insurance across state lines, full deductibility for everybody's health insurance policy, pre-existing condition language that'll be good and operate within the states so it's not unconstitutional. We can go on and on and on with the good things.
I just believe that the Democrats would be a lot smarter to say, let's do it the right way. And let's do it in a bipartisan way. And if we did, then hopefully we can move towards some of the ideas that Heritage has. Heritage has some great ideas in health care.
Basically what folks like myself, fiscal conservatives would say, listen, let's have faith in the free market system. Let's understand the root cause of what's driving costs. One of the root causes is the fact that we separated the consumer of the product from the payment of the product.
I'm concerned that the American people have very little experience with undoing really bad legislation. If you look back through history, there are very few places where really bad legislation was reversed by a subsequent Congress and repealed. So we've been trained to accept legislation that goes into law as the voice of the people, the reflection of our constitutional republic as it was designed by our founding fathers. But what happened is that they used legislative shenanigans. It wasn't the voice of the people. It wasn't really a majority position of the American people. They force-fed this on America. It is in the code. It is the law of the land. But the American people need to understand that we're a republic. We can undo bad law, and we need to be determined to step forward and undo bad law. That's what Obamacare is.